in some way. I agree totally, Ms. Mace, with what you said, but so that everybody doesn't leave after the program.
Well,
I think we need to look at it, exhibition
with
session.
the people that arranged the program. So that was an excellent program that was planned for lifetime, and nobody stayed to listen to it. Don't say
And
nobody,
really,
I stayed
there
until
are
that
things
meeting was
that-
over with, because I was in
Well, I
bed.
did because it was running too late. I really didn't stay. I
Because
intended to.
our proposers in the dialogue made that should have been listened to, and when I was shocked when the chairman of the committee said that it was approved, all the other sections but one, thought that all the changes were okay, because they are not okay if you really study them. The state committee brought that out last, it's in recent time, but nobody paid any attention to it.
Well, I think the problem here, and this was stated to me by many of the people that were leaving, is they had heard this report in their section, the review of the AMA structure.
Oh, yeah, they had it, but they hadn't heard what we were going to give them, because that was what came from the state committee, was what we were going to give them.
Well, I want to apologize. I brought a new person with me in my car because I was trying to encourage membership, and her time ran out, and I could not be discourteous to her, and I really wanted to stay, but I had that kind of experience.
And would this group like for us to go ahead and just mimeograph your financial reports and have them present? Yes, ready to have two things, as I said.
You wouldn't vote on it that night?
Here, the program, program, where it comes from the member of the meeting, and also facilitating the training on the, if we could summarize.
Would it be possible to get, as I see it, about the owner reports that we are going to need to deal with is with reference to this structure of ANA. There's nothing in any report that's been given here tonight that is going to do more than just a very brief statement, with the exception of that, and then the finance. I wonder if we could have, say, the finance report mimeographed or whatever is necessary there. I don't know, Ms. Atkins. You will know what to do about that.
Audit report, you would
Audit
have
or
to.
whatever. You don't want that whole thing mimeographed, but whatever is necessary to get it in the hands of the members, and then this Miss Rosecrans committee report, have that mimeographed and in the hands of the members, so we'll know what we're doing. If we could do that, well, I think that would probably speed things up considerably, and then have the program first. And recommend that we have it first. I'd be willing to make that motion that the board recommend that we have the program first. If the motion is in order.
Let me throw out this. Is it feasible at all to consider a resume of this board meeting to go to the membership? To meet on Monday, and then the membership meets on Thursday.
Well, there are certain, that's the reason you have it at the time.
Yeah, I realize we give this in verbally, but I was thinking, I'm asking for information.
Oh, you mean a written resume?
I don't believe that would work at all, because you've just got from Wednesday to Thursday to get together and get with the secretary and get it all. I don't think it could be possible. If, actually, if you're just going to give the resume, it won't take over 5 minutes. Telephone.
Because it's not too much that has to go. The main thing is the finance report about the raising funds. That's everything to go.
Make up new agendas and just get ready for them. Limit the time of each person that gets up to argue. That would help. Get out in a hurry.
This would seem really fit to another suggestion, and that is that we could limit time on our business meeting. If some people want to continue to have it first, it doesn't really matter to me. And then if there's other things, we just have to have it after the program.
At the membership conference last year, South Carolina,
prerogative of the board to suggest that we have program first? Or is that what I'm doing, the district as a whole?
You have to
Doesn't
vote
this
on it.
require, according to Robert Rules, we would have to, since this is our word of order, excuse me, this would, at each meeting, I think we, since our bylaws call for Robert Rules as the authority, and this is the way Robert Rules go, the business, and, I think that each meeting, you could simply entertain this motion at the outset. Wouldn't require any action.
It seems to be also that, the people who are bringing in reports could really streamline those reports so that that wouldn't take up too much time either. Just kind of written report, put all the numbers in.
People who bring reports to here. And then we get the reports here that we never get in that, but none of that.
It was nice for them to hear whether or not they are active or not. The Generally, the girls are finally getting together and dozen, baker's dozen.
I think if we be honest with ourselves, that, most of our time is spent not in hearing the report, but in today's, issues, and I would ask the board to give some thought and maybe possibly in this time we might need to entertain the thought of a limit time in the day.
And the number of people on the debate. I think that's where our new parliamentarian's gonna help us out an awful lot too.
It would be necessary for the assembly to vote to limit the age, but that is a parliamentary question as well.
May I ask, in order, we have to change the order of the day, and we have to come on the floor this week if we want to hold the membership, we have to change.
You could ask if they wish to do that. It's prerogative of the president to ask that if you want to.
All the business is outlined in the bylaws for both the regular and
Then, with the, I think, I saw some nods, we need to have some definite confirmation about having the finance committee report.
I'll streamline it. I'll streamline it for you.
And then we don't have to listen to the monthly report, do
Do
we?
you have any idea how
Well,
I can?
they used to, when I went in, the way they did business with them was to go ahead and give the totals of the, receipts, disbursement, and the balance. And, that these be placed on file automatically. And then the audit report, which, has to be voted upon, be read in.
We'll streamline it.
Is-
We'll streamline it Thursday.
May I add something? I'm like Ms. Pope was. I can't take a financial report in from a verbal report really and truly, in a big meeting particularly. And I wonder if, it would be good to have a mimeographed copy either for the board or if you want to, if Ms. Atkins says it doesn't take very much to mimeograph a lot of sheets, if it wouldn't be something of interest to the membership to see in black and white. And then when she gives her report, she could just give the totals and it'd be much easier to follow. I have that kind of
I think to
reaction.
give the demographic report to the board, but streamline it for the meeting as a whole, if anyone's interested.
Oh,
The
you would
files are
recommend
always
that?
open. The
Yeah.
files are open if they're interested, they can go down and ask to see the report, or see the report at the end of a meeting. But for the board, I think it would be fine.
We would have, all of this is in the form of suggestions, and I understand, do we have agreement on these?
I don't think it's just fair, let's just try. Do we have to have, why can't we just try?
Try each other out.
You want me to make,
For the board meeting, next time.
well, then you want me to make you a copy of the audit
we need to, give some thought to Nurse Week, the proposed plans for May 8th through 14th. Do you have anything, to comment on at this time?
Early report, you know, several reports. I've been told that people want to talk about people.
Mhm. I raised the question, to Ms. Atkins, after, having heard Mrs. Hutchins speak, I had heard it certainly come out probably in membership or from a committee recommendation to, I heard the discussion with the state executive board as to this board's position relative to the ANA proposed bylaws, and also our membership position relative to the proposed bylaws. What are our recommendations? Ms. Hutchins, speak, go back to your district and, find out. I have heard
That's
the
the reason.
study committee's report, but, has the district and has this board taken, a stance?
I think we'd better hear that committee report, and that's the reason I'd asked if it was possible to get it mimeographed, because that is the crux of the whole thing. And I have read these new bylaws, and they sort of beg the question in there, but actually in principle, they change very little. I went over them because it came in after I had made the statement that I did down at the Surgical Congress. And these new bylaws are still, in essence, are just about what they were. For instance, the question of the election of 3 commission members. It says 3 should be elected. Prior to that, it said 2 would be elected. And then to go on and give the board the right to appoint a person. So actually, it doesn't, you're just begging the question.
Has our district on record?
No, we haven't, and we can't intelligently go on record until we have a report that can be reviewed by the members and let them make up their mind what they want to do.
When we're gonna have the membership will have the last opportunity to service this year, make some expression, and your board has one more meeting in May before they go to this.
The membership.
Well, now, doesn't, coming back, and this, I know the people want to go home, but coming back to the question of the bylaws, doesn't our bylaws require, say, that there'll be a meeting in May? And if there is, then we'll have to have a business meeting in May. That is, if we're going to follow the bylaws, and if we're not, why have them?
Well, somehow, before I went in office in 1960, they started, or I believe it was in 1960, they started having nurseries.
Well, that was in addition to the district meeting.
We haven't had a district meeting.
I know you haven't, but prior to that, we had district meetings, and we had this Nurse Week set aside and a special program on Florence Nightingale's birthday. And according to you, now I think that the bylaws specify that there must be a meeting in May, and if they do, then we'll have to have some sort of a meeting in May. Now, you can have Nurse Week and you can have nurse whatever you want, but you've still got to have a business session if you comply with your bylaws. Now, that's my interpretation of it.
Well, that's the same thing as too, with your November friendship
It
dinner,
certainly
it's just
is.
something
That's
that y'all
right.
been doing
That
through
is
the
it.
years, and nobody has.
Well, I can't help it. We've been doing it wrong.
Yeah.
Ms. Pope told us that Ms. Lewis pointed that out to them.
Our bylaws.
And 2 wrongs doesn't make a right. Here it says the regular meeting shall be held on the 2nd Thursday in January, March, May, and November. The annual meeting, the 2nd Thursday of September. So it's spelled out. It doesn't say anything about it.
But don't you also state in there that the board sets the time and the place, and if you didn't want it to think.
Yeah, but you can't violate it if it's spelled out.
That's special meeting.
Now, that's just where we run into they were special meetings.
You didn't have any business session.
Yes, no, but we had our regular business meeting, regular meetings. And then these were extra, as I remember it. Which I could be wrong, nobody
Well,
absolutely.
we don't have one
exact.
set for May, so,
Well, you do have one set for
well,
me.
you don't, I mean, in other words, it has not been publicized to have one, we don't have the appointment to have one now.
Well, you
Carrying the
you-
old procedures for the last
Yeah.
several years of having either tea or ceremony. So, if you're going to set one, we better, provision starts now.
Well, you- the bylaws have said it, we
They say
haven't
they
said
have to be
it.
business meetings.
The regular.
Well,
Today, set up too.
Well, you can plan your program and go ahead and have it, but you're going to have a business session to follow, or prior to, or however you want to do it, and then there should be no difficulty. And if it's not on your calendar, it should be on there.
It isn't on the, blue one,
It
but
is
on
not
our
any
card,
on the card either, because it's
there's
open.
May and it says open.
But it does
It's not
say you
there.
won't have it, so it just needs to
We're,
write it in.
we're covered in that it is stated that it's open.
That's right.
So we're covered. Well, it's already established by bylaws that it's the second Thursday. Place and time to do it. We established earlier that the time was 4:30 p.m. for our regular meeting. Second Thursday.
Yeah, this one. The 14th.
Now, your program that you have planned could extend on into the evening, or however you want to do it.
Oh, I'm sorry. April. Yeah, well.
That's on Florence' birthday.
Hold on.
What's that?
I say the committee, the career committee. The committee for that day.
Mm-hmm.
No,
We
because
just
we just
understand they have a business meeting. I mean, it's too far off.
Or else have it the phone program.
Very well, then we would have established, an hour, and they,
4:30 in St. Joseph. Then I was gonna, make a stand by that time on A and A. Supposed to do that, I was trying to,
Or do y'all want nursery of the year program? Maybe we
Oh,
will find out about that.
I think that this report, this Rosecrans report, could be circulated at this meeting and give us time to study it, and then act on it, and would be time for us to have.
That's, and I can't speak for Ms. Rosecrans, but I'm not sure that she can get, a report from her committee circulated by Thursday.
Oh, I see, I'm sorry.
I would.
I thought you said you had a written report. I
No,
beg your
no,
pardon, I didn't.
she reported
I
to
withdraw my
me,
remarks.
she reported to me that her, committee would meet once again, hopefully before the membership meeting Thursday, to go over these last minute.
Oh, I see.
So I do not envision that we would have a report, other than a verbal report at membership committee, and I'm not sure that she could establish that since I gave her a copy of the distributed paper. Very good. We may well have a report from the committee on Thursday. Hopefully we will. I would like to take about 2-3 minutes to give you a brief rundown on the board meeting that I attended on February 19th. We ended the year financially with a balance of $168.07 for GSMA. We had a motion to recommend to amend the bylaws increased dues by $2.50 per member, and this was carried. And motion to receive, that is the board members to receive monthly treasurer's report, a written report, at the board meeting, that was carried. The motion was, it ended up that all, the three sections, EACP, NSA, and public health, to get the minimum standards circulated to employees of nurses. This was carried. And, we had a report from the arrangement committee and the program committee for the state convention, and I believe I neglected to continue to hunt that out this morning and last evening. I had left some of my work at the office, but the convention is to begin, I believe, November 7th. I'm not positive, but the theme, the working theme is challenges facing nursing today. Yes, Tuesday, November the 8th. We get underway and go to Saturday. Ms. Frances Purdy, chairman of NSA, ANA, to be invited. If a second person from ANA, Ms. Lahode, is to be invited. There was some discussion that would interest the group, I believe. Tuesday to be a board meeting, Wednesday to be a business meeting, Thursday to be program in the morning, section in the PM, Friday for the program in the AM, section in the PM, and Saturday to be final business section with installation of officers. The recommendations and discussion for the report of the tellers and declaration of officers to be moved in the agenda and be announced earlier in the convention program. Report of the Economic and General Welfare Committee. Report, there was made a note that North Carolina had 7 BS programs, baccalaureate programs, and 4 associate degree programs, and South Carolina was expecting to open 5 degree programs. The Professional Nursing Practice Committee, and I should have circulated this earlier. I regret have planned a conference, and this is the tentative program on professional nursing practice, and the only thing that they have identified thus far was looking at our professional sales for Wednesday, April 13th, Thursday, April 14th, and Friday, April 15th. We thought that it probably will be held over at Stone Mountain, at the new Stone Mountain Motor Hotel. And registration would be $2 per day or $5 for 3 days to members of GSNA. Non-members, $3 per day or $7 for 3 days. And students would be invited. And the program is quite interesting. The first day is Committee on Professional Nurse Practice. Ms. Lott, who is chairman, would preside. I'll pass this around and let you see. And if there are those who use copies, I'll try to have some copies made. You remember that we discussed redistricting. The board did approve redistricting. We had a vote of 9 for, 4 against, and this was to be effective in 1967. General agreement that the district had provided extensive of the president to GSNA board meeting. We had the appointment, the Joint Commission for the Georgia Hospital Association has invited 3 members from GSNA to serve, study, and make recommendations regarding employment standards. And Ms. Dixon and Lady All and myself were appointed to serve on that committee. And I believe the bylaws committee report I have just here. The bylaws chairman, Ms. Cumlin, requested that, or we were given an extension to review bylaws, and I don't remember the exact wording, but as soon as possible after ANA convention, that we can forward it to state bylaws committee because of the anticipated change that might come out of ANA, or that would come out of ANA. And I believe that is a rundown of the board meeting. Almost all sections and committees did have written reports. Is there other new business to be brought before the board? Announcements? Yes, you don't have any. Then, entertain the thought for adjournment.
Madam President, now, next presentation. I move that we reverse the order of the agenda and present the program.
Have a motion to reverse the order of the agenda and move to the program first. Is there discussion? All in favor of reversing the agenda, please indicate by saying aye. Aye. Opposed, no. So we'll turn the program over to the program gentleman, Ms. Francis Holmes.
And you know I'm not Mr. Henry, but I want to introduce our first two speakers for this afternoon. The topic of our program this afternoon, the nurses security. And it's divided into 3 parts. Man enter security, and Chaplain Robert E. Ballard will give a short talk. And second, the nurses conferences, and Lady Ross will speak, and I will let Ms. Candy introduce the other 2 speakers when we get down to them. And I wonder, Chaplain Ballard, if you would open our meeting with prayer. Excuse me,
Eternal God, the giver of life, and we who participate in life, come asking that you might strengthen us, we might continue to share life with our fellow man. We pray thy blessing upon this meeting. The leaders and each member that participates, as they endeavor to strengthen this organization, they might prepare themselves better for the service of healing and faith. In the name of Christ, we pray. to increase her chances, she decided to take a trip abroad. While making this trip abroad, the train, which she was riding, was caught in an ambush between two political parties in a small country, and she and the others had to get off the train. A few hours later, the conductor sounded the alarm all aboard, and he saw this young lady standing out in the field. Her dress had been torn to strips, binding the wounds of the soldier. The conductor cried out, "What are you doing out there?" And the lady answered, "I'm holding back hell for these dying soldiers." The lady returned to her hometown, and someone asked her, was she still interested in becoming president of the hometown literary society? And she said, "No. I've come to believe there's only three things that matter in this world: God, man, and how can I help man to live?" As I read this story, I thought about how often we're caught up in looking for inner security by seeking position, being successful, or making some contribution to a certain organization or a particular field of service. However, as you see and as the young lady experienced, inner security often comes only in relating to life. And here we have to ask the question, what is life? Being a chaplain, I have to go to the Bible. And the Bible portrays God as life, creator of life, redeemer of life, sustainer of life. And part of God is in man. And this gives man a feeling of life. Why do we often find man living in hell? If this is true. And according to the young lady, hell is death. But I don't see hell in this perspective. I see death as a part of life. I see hell as being alone, separated from life. And the worst form of hell that a man can experience on earth is having to die alone. And when we picture hell as death, this would cause us many times to want to leave people when they are dying. And this is putting man in hell. Doctor, nurses, chaplains, we're all threatened to leave. And we fear we've done our best. And let people die alone. I feel that the young lady found inner security while standing with dying men on a battlefield of war. And here she pictures what the Christian faith has to offer to people. I, the eternal God, will hold you by the hand, whispering, comes when we feel alone. And when we leave people, become separated from people, whether they be living or dying. Inner security, to me, is found in life. And life comes to any man who will relate to God, the creator of life, and who will relate to man, who is the living creation of God, creation of God. A nurse who can look to God every day for strength of her life and happily turn and share this life with man who is sick, lonely, and many times in hell. This nurse, I feel with spirit, true, inner security.
Major Roswell.
Fellow members of the Board of Witness. I think my subject is going to differ just a little bit from the announcement because this subject is closest to me in my security and in your security, really. Right now, you know what the military is facing. You all have a TV and you read the newspaper. Each day it changes and it increases. The military buildup has been tremendous, and I can tell you this because it is factual, even though you have not read it. The military buildup will continue, and it will continue to be much greater than it is now. At the present time, we are reopening, we are rebuilding hospitals in the Far East to open them up throughout the islands which have been closed since the end of the Korean conflict or war, whichever term you give that particular era in which we were fighting. Right now, we do have a tremendous number of our young men dying, wounded, or deceased, protecting us. The Board of Directors of the American Nurses Association has stated that it will support the military to ensure adequate nursing care in our national defense. They have stated, and I quote, the professional support of the long-range defense program, encouraging nurses who are eligible to serve a minimum of 2 years in the military service, end quote, is sponsored by them. The projected nurse requirements for the military services are 17,275. The Army, 8,243. The Navy, 3,440. And the Air Force, 5,592. The total defense requirements of 4,500 nurses are needed before July 1966, and an additional 5,000 by 1 July 67. Of the three services, the Army Nurse Corps at the present time has 3,300 nurses. We need an additional 4,000 nurses to give our fighting men adequate nursing care and the security that the chaplain said they need. 542 men nurses are now members of the Army Nurse Corps. In Vietnam, we have approximately 275 military men and women stationed in various outposts throughout Vietnam. Of these, there are Army, Navy, and Air Force. The Army has more than 200. The Navy has 39. This includes 29 nurses on a hospital ship Repose, and if you want the news last night, you did get a glimpse of the hospital ship Repose. And they had 17 nurses working. They had worked 36 hours, and they had taken care of approximately 280 casualties in 24 hours. They need more We have Air Force nurses stationed at various dispensaries. These are male nurses. We have Army male nurses stationed at 1st Cavalry Division and the Airborne Division. These men are qualified paratroopers, and many of these are our nurse anesthetists. You've all been reading various things in the paper, and some of them are really shocking. The Secretary of Defense, McNamara, has authorized each of the military departments to increase its recruiting efforts for nurses, whatever means or what steps will be necessary to be taken. And since the number of persons qualified in the nursing profession who have volunteered for active military service are insufficient to meet our needs, Selective Service has given the authority for the drafting of male nurses. This was signed by the President on 10 January of this year. In this fall, the Army has requested a total of 700 male nurses and the Navy 200, and this will be for the period of April to July. How many more will be called in the male nurse draft act, we do not know. But one particular point I would like our women of the United States to know, we live in one of the few privileged countries where the American women have never had any compulsory military obligation. It may be clear. We have always met our requirements by volunteer. It has been done before, and I'm sure it can be done again. At the beginning of World War II, the military service on active duty had approximately 800 nurses. At the end of World War II, the Army Nurse Corps alone had 67,000 nurses. So we do have nurses. We hear shortage of nurses. I know there's a shortage of nurses. I also know there are many nurses who are not nurses. And I know many reasons, and so do you, why they are not, and they all are not family time. Our military requirements are great, and also our requirements to these men who are your brothers, your cousins, your next door neighbors, or some of your sons. They must and they will get the adequate nursing care they require. As the total strength goes up, so does the total medical requirement. And this is regardless if the man is overseas fighting or if he happens to be down here at Fort Benning, Georgia, having the flu. They need nursing care. They also need doctor's care. Dr. Draft Act and the Dentist Act, is in effect, and it will remain so, and I'm sure it is going to be increased from what I hear. We would like the cooperation. Many of you people present here today have served time in the military, but you also come in contact with our young ladies and our young men who have not. Thank you.
Our third participant in this position states that you should be independent. He's going to talk to us about man's perspective.
I'll no doubt be talking in the same room at the end of this month to about 40 professional adjustment students, and I'll probably have a 2-hour lecture, and I'll be full at ease of myself and be able to handle it with complete confidence. But when Miss Hammond asked me to speak just 5 minutes, I found that trying to pull these little words together is rather hard, because I want to give you some things to think about, because in economic security in your field, you do have certain things that you must consider and think about as you go along in your profession. There are many avenues for economic security, but I want to discuss briefly 3 types with emphasis on 2 numbers, 1825 and 1953. I'll explain these numbers later in just a few seconds. Economic security from the standpoint of insurance represents normally 3 types of risks which you must assume or pass these risks over to someone else to help you assume. And they are these. 1, a casket risk, time, there must be some money there for them because you're out of the picture. So that's one type of a risk that you must assume in this economic security. A living risk is in two packages. A living risk is a risk from this standpoint. A serious disability which you may permanently incapacitate you for life, or for 2 months, or for 6 years, can hit you, and if so, that's a living, sort of a living risk that you must assume. A second type of a living risk is a judgment by law, due to your negligence in your lay or your professional life, which requires you to pay from your earnings some money to another person. Recently, I have a very dear friend who's been involved in an automobile accident, and he finds that he has a judgment placed against him now of $27,000. He has exactly $10,000 to pay the judgment, and he will owe the rest. He'll be hounded probably the rest of his life till he pays that judgment off. To me, that is a living type of a risk. It's different than death, but it is a living type of a risk. And then you have what you call a retirement risk, when your earning production stops due to your age. Yes, Social Security and Medicare will help, but we all need to have a bit more saved up to give us that additional amount we need when we retire. I begin to see that in a different light. 10 years ago, I didn't worry too much about any form of retirement. I find at my age today, at 52, all of a sudden 62 is right ahead of me, 65 is right ahead of me. So therefore, that type of a risk is a risk that we must assume, this thing called retirement. And now here's where this 1825 and this 1953 comes into the picture. These two dates are not according to Frank Sinatra's new song, Good Years for Small Town Girls. They are actual amounts of money which you must have on hand in pocket at your age of 62 or 65. For instance, at your age of 62, if you wanted to have $10 a month the rest of your life given to you by a reputable insurance company, you would have to give them $1,953 in cash. Or if you wanted to wait until you were 65 and then get $10 a month the rest of your life from a reputable insurance company, you would have to give them the total sum of $1,825. How do you lay aside this type of money? For instance, you can see at my age of 52, if I wanted $10 a month the rest of my life, at my age of 65, I would have to put aside from now until 65 approximately about around $170 a year. If I wanted to get $100 a month, I'd have to put aside $1,700 a year. Now, where do I get that money? That's your problem as well as it is mine in this economic security that we have to live. So I lay this to you. It may be wise for you to take 3 approaches and do it in thirds. Take a look at a wise stock investment program. Second, consider the purchase of land. And third, put aside a regular premium on some sort of a life insurance premium. I wish I could give you an easy way to assume these risks in your economic security, but I suggest that you think seriously about them and discuss them with your stockbroker, your real estate salesman, and your insurance counselor, not once, but at least once a year.
Certainly, we're indebted to these fine presentations of positions and security for nurses, and a very timely speaker as our fourth speaker, and his topic is Medicaid. In our great society, especially in the United States, put them all out principles for this message to be passed to people on the greatest democracy on earth. And we have engaged today a very fine and learned representative from our regional office of Social Security, Mr. Neil Paul. Mr. Paul?
Thank you, Ms. Tanner. First of all, I'd like to say that I'm going to take longer than 5 minutes. I will try to limit it to 20 to 30 minutes. And then at the end, I will entertain questions from any of you. Effective July 1st of this year, 19 million Americans health insurance for the aged. Now, the reason for my being here is to explain this law in brief terms and then answer questions. The first thing you must understand in order to comprehend this law is that it is divided into two parts. The law is written in Part A and Part B. Part A refers to hospital insurance. Part B refers to medical insurance. The hospital insurance covers hospital bills. The medical insurance covers doctor bills. They operate independent of each other. An individual may apply for either section or both. The law applies only to people who are 65 years of age or older. It does not apply to all people who draw Social Security because some people draw at age 62. Some people are young widows with children and so forth. Some people draw on disability and it does not apply to them. It applies only to those people over age 65. And it applies to all of those individuals over 65. They do not have to be drawing monthly payments from Social Security. They do not have to be eligible to receive monthly payments from Social Security. In fact, they don't even have to work under Social Security or have a Social Security card. They qualify if they are 65 years of age. In almost all instances, there is one instance in which an individual does not qualify, and this would be the civil service retiree who retired after July 1st, 1960, and he has his own type of federal hospital and medical insurance coverage. But for all practical purposes, we can say that all people over 65 will come under Medicare. Now let me explain first of all the hospital coverage. Remember I said that the hospital coverage and the medical coverage covers doctor bills. The two operate independently of each other. So I'm not talking at all about doctor bills. I'm not talking about doctor bills. I'm talking about hospital bills entirely for the next few minutes. The law starts July 1st, 66. Basically, it covers the individual's entire hospital bill except the first $40. The patient will be required to pay $40 when he leaves the hospital. The hospital will send the federal government through intermediaries, insurance companies, the bill for the rest. If this individual enters the hospital on a semi-private room basis and does not have any other extras such as private duty nurse, special consideration, TB tests and such as that, we pay the entire hospital bill, what you can consider a hospital bill except the first $40 on a semi-private room basis. If the individual would like to have a private room, he may pay the difference in addition to the first $40. The difference between what that hospital charges for a private room and a semi-private room. Now this coverage is total for the first 60 days. He can get by with only $40 bill if he stays 60 days in one spell of illness. It pays an additional 30 days, but at a cost to the patient of $10 a day. So we see that the patient can have 90 days of in-hospital coverage. He pays only $40 for the first 60 days and $10 a day for an additional 30 days for a maximum of 90 days in pay $5 per day if he's in an extended care facility for more than 20 days. The first 20 days is free. The last 80 days at a cost of $5 per day. In addition, under the hospital coverage, the patient is allowed outpatient hospital diagnostic services at participating hospitals. The patient pays $20 deductible and 20% of the remaining charges for outpatient diagnostic services. In addition, and here's where you nurses are probably most interested, or your friends at least, who do not work for hospitals, up to 100 visits in 365 days following discharge from the hospital or extended care facility. This refers to public health service nurses, home visiting nurse, as we call them, public or private agencies. It will furnish to this person over 65 up to 100 visits at his home for treatment, therapy, and so forth. Now, that's a brief outline of the hospital coverage under Medicare. The individual may apply for that and that alone. But there is another part of Medicare which the individual may apply for. And if he does, it costs him a premium of $3 per month. The hospital coverage costs nothing. That is, no premium per month, no monthly charge. It costs him only the deductible when he uses it. The Part B, the other section, medical insurance, does cost the individual regularly $3 per month. If he's drawing Social Security, the $3 per month will be deducted from his monthly Social Security check. If he's drawing railroad retirement or civil service retirement, the same is true. If he is not eligible for these, he must pay $3 per month and he will be billed by the federal government. This also goes into effect July 1st, 66. I believe I failed to mention the fact that the extended care facility in connection with hospital coverage does not go into effect until January 1st, 67. Now we're going to the medical insurance. The patient pays the first $50 per year of his personal doctor bills. In addition, he pays 20% of all over $50, so that Medicare, under the medical insurance, pays 80% of all over $50 in doctor bills. This includes all doctor bills that we normally think of as doctor bills, including house calls, office calls, the surgeon in the hospital, and so forth. And the patient does not have to be admitted to a hospital before this part was paid. Pays all his doctor bills, whether or not he goes to the hospital. It covers all of his doctor bills, I should say. It pays after the first $50 and pays 80% of all of the $50. In this medical insurance section, there is also provision for another 100 home visits by public or private health agencies in the year, and in that case it's on a calendar year basis. Under the hospital coverage, it's the year immediately following discharge from the hospital or extended care facility, but in the case of the medical insurance, it's 100 visits per calendar year. Other services under the medical insurance include diagnostic X-ray and laboratory tests and other diagnostic tests, X-ray, radium, and other radiation therapy, ambulance service under certain conditions, surgical dressings, splints, casts, etc. There's also provision in both of these sections for psychiatric treatment, but there is a limit. I believe it's 190 days, lifetime limit, hospitalization for psychiatric treatment. In other words, if a person goes in a mental hospital for life, we will not continue to pay the hospital after 190 days have been used in his lifetime. I'd like to talk briefly now about how people qualify for this. I am sure that all of you have relatives who are 65, your parents, grandparents, aunts, uncles, and so forth, and I will just mention briefly what they need to do. If they're drawing Social Security, they have the hospital coverage. They need to check a little card that came in the mail to them. Yes, if they want the medical coverage and they want to pay the $3 per month. They need to do that before March 31st of this year, or they will not have the medical coverage effective July 1st, but will have to wait 2 years before they do get it. That's if they're drawing Social Security. Those who are not drawing Social Security or railroad retirement need to make application to the Social Security Administration and prove their age, because this is only for people 65, and we don't know that they are 65. And they do need to do this before March 31st of this year. I think I've talked just about enough on it. I want someone else to do a little talking and ask a question now for the next 10 minutes or so. Who has a question? I'm sure that some of you have been studying this because I've heard you mention it. Yes. That's a good question. When I said the person must wait 2 years, I was referring to the person who is already 65. Because he may sign up only during what we call an open season, like Blue Cross Blue Shield. And the open season is every odd year starting October 1st. So if he doesn't sign up now, he will not get another chance until October 1st, 67, and his coverage will not become effective until the following July 1st, which will be July 1st, 68. So if he misses this March 31st, 66 deadline, he will not be eligible for coverage until July 1st, 68. I'm talking about the person who is already 65. Now, to answer the rest of your question, for someone who reaches 65 this year or on into the future, he may sign up at any time within the 3 months preceding the month he is 65 or 3 months following the month he is 65, giving him a 7-month period in which to apply. Now, keep in mind, I'm talking only about Part B of the law, which refers to medical insurance. There is no limit on the hospital coverage. However, we prefer that they all sign up as soon as possible on the hospital coverage. We don't want to be taking claims from patients in hospital after they've already been in it and so forth. Along that line, let me mention briefly what these people will be showing when they come to the hospital. It'll be just a small card, Medicare card, with red, white, and blue stripes at the top. Their name, their Social Security number, and right at the bottom will be indicated whether they have hospital coverage or hospital coverage and medical coverage. This is all they will need to show to be admitted to any of the participating hospitals, and this will include almost all hospitals. I beg your pardon, I couldn't. That's another question we always get. This lady asked, what about it if you have already an insurance policy covering hospitals, doctors, and so forth? We're advising all people definitely do not drop the insurance you already have. The effective July 1st, their private insurance will no longer cover the things that Medicare covers. And the premium rate will be adjusted accordingly, and they will hear from them later about it. In other words, people over 65, in some cases, will no longer have coverage in their private insurance policy for the things that Medicare covers. So they should definitely, in that case, apply for Medicare. Now, I'm not speaking for all insurance companies, but I have seen as many as 4 or 5 different insurance company letters similar to the one I just mentioned.
If an individual has a card for Medicare insurance, since the card came out, the advisors for them to apply to a hospital somewhere, this Part B of.
I'm sorry, I didn't get,
This
speak a
individual
little bit louder, if you will.
already has his card for Medicare insurance to have, they got to the mail. Do they have to get in touch with a particular hospital of their choice and make it known that they would apply at the hospital, given, 65 or they're over 65? Should they get in touch with the hospital before this time?
No, the individual need not notify any hospital that he intends to enter that hospital if and when he gets sick. All hospitals that we think of as hospitals will probably be participating. And all he needs to do is just show his Medicare card when he enters. The hospital will then know that the federal government is backing up all but the first $40 if it happens July the 1st and if this hospital is a participating hospital. Now, along that line, I might say that there's free choice in this program, complete free choice. In other words, the patient may choose any doctor he wishes, and any hospital his doctor sends him to. The federal government will control this in no way. Some doctors will not participate. Some have said they won't. In other words, they won't send their doctor bills to the insurance company named by the federal government. In this particular case, the patient can still collect from us by paying the doctor, bringing the receipted bills to us, and we will pay 80% of all over $50 in the calendar year. This question always comes up, which doctor do I go to, which hospital, and so forth. You choose your own. Yes.
I have been asked a question about the doctor's fees. Well, there's quite a variety of charges by different doctors. Is there any kind of standard that the federal government sets down that they will pay? Let's say for that, that could be one doctor will charge $200 and the next one will charge $500.
Yes, there will be a schedule of fees, and it will be different by geographical location. I don't like to say that the federal government will decide what the fair charges will be. We prefer to say that the medical profession is going to decide it, and the insurance company. The insurance companies of America are going to be the intermediary between the federal government and the provider of services. By this I mean the hospitals and doctors, for the most part, will be collecting from private insurance companies. These companies the patient will pay the difference between what this particular hospital charges for the findings, in addition to the $40 a day.
I'm sure the ancestors provide the fact that still be a problem if
I understand your question, and I understand all the problems that are going to come out.
if the patient wants to send a private room and the hospital cannot give them a free private, they have a private.
Well, these things are going to have to be ironed out. I should have started my talk with the statement that I don't know all the answers, and I don't know, and I won't know them for several years yet, and then probably never, all of them. But when we gain more experience, these things will be ironed out. That's a good question. I made the statement that you didn't need a Social Security number to qualify for Medicare. You just had to be 65. But as a matter of fact, when you apply for the Medicare, we issue you a Social Security number, which is your Medicare number also. So you do need a Social Security number and a Medicare card. So we'll issue it to the individual when he applies for Medicare. You don't need the card in order to apply for the Medicare card. You don't need the Social Security card, but you will be issued. I noticed several of you still have your hands up. I had promised to keep this to about 20 to 30 minutes, and 30 minutes is up if I'm right. I would like to answer all of your questions, and I will be glad to stick around after the meeting if you have a particular question that applies to a particular relative. I'll be glad to stick around as long as you people would like for me to. However, I don't want to take up the time of the rest of the meeting. I certainly do appreciate your attention.
There may be guests at the business session, and we will also, take these regarding moving on into the business meeting. We'll have roll call by section. We may have your attention now. We'll have the roll call by section.
Administrators, please stand. Would you announce so we get them? 33.
33.
EACP section, please stand. Six. General duties, please stand. Occupational health. Private duty, please stand. Public health.
regular meeting of 5th District GSNA was held on January 13th, 1966, at 4:30 p.m. St. Joseph Infirmary. The meeting was called to order by the President with poll. Prayer by Ms. Hudson, Chaplain. Roll call by section. EACT 12, Administrators 35, General Duties 5, Occupational Health 1, Public Health 18, Private Duty 10, making a total present of 80, quorum was established. The minutes of the special call meeting, 5th District GSNA of April 29, 1965, were asked to be read by the President. Secretary read the minutes of April 29, 1965. A motion was made. The minutes of April 29th be approved as read by the Secretary. Hudson Line. Yes voted 20, no 60. The motion was lost. A motion was made. I move that the minutes of April 29, 1965 meeting be approved with the exception of the detailed reports prepared by the GSNA parliamentarians, which shall be attached to these minutes. Yes voted 64, no 16. The motion was carried. Minutes of the September 9, 1965 annual meeting were approved as read. A report of friendship dinner held in November was read by the Secretary. Communications were read by the President. Acceptance of office and duties it incurs and plans for our district was given by a new President and post. Resume of Executive Board meeting of January the 10th, 1966 was given by the Secretary. Report of the Treasurer, Ms. May. District report read by Ms. May. Motion to accept this report is placed on file. Motion carried. Register report read by Ms. May. Motion to accept this report is placed on file. Motion is carried. Report of Executive Secretary given by Ms. Atkins. Report of Committee, Program. In Ms. Hammett's absence, the report was given by Mr. Hackett. Bylaws. Ms. Hudson was appointed new chairman of this committee. Legislation. Ms. Pittsfield gave report. Study on A&A functions, report given by Ms. Rosecrans. Report of section. EACP, Ms. Bryce gave report. Administrators, Vice Chairman gave report. General duty, Ms. Thornton, written report, which was read by Ms. Atkins. Public health, Ms. Hasty gave report. Occupational health, no report. Private duty report given by Ms. Zerk. New business. Mrs. Zerk made an announcement that the Southeastern Surgical Conference will be held here at the Marriott Hotel on April 28th through March 3rd. All nurses are urged to attend. A motion was made that the 5th District GSNA recommend to the President of GSNA that if funds are not available for a February board meeting, that she canvass members of GSNA board to determine if a quorum can be established through enough members who would assume responsibility for their own expenses and or who could have expenses paid by their district association, and if so, a February board meeting be called. The motion was carried. The motion was made that 5th District go on record to endorse and request the establishment of a co-ed school of nursing at the Georgia State College, and that a letter be written to the President of the college advising him of this action. The motion was carried. An announcement about the allied medical careers was made from Ms. Pittsfield. Ms. Genevieve Jones was in charge at the time of closing, when members asked questions of the panel about the proposed changes in the structure of AMA. Adjournment at 6:40 p.m. submitted by DM Office Secretary.
Are there corrections to the minutes? They will stand as read. At this time, I would like to share with you some communications which I have received. We have a acknowledgement from the family of the George Hamilton, an acknowledgement of gratefully acknowledging and thanking you for your kind expression of sympathy. The family of Dr. J. Elliott Scarborough acknowledges with grateful appreciation your kind expression of sympathy. I have a letter with the details which I will share with you if further details are needed from Mayor Margaret Williams, Dr. Mayor Margaret Williams, Director of Graduate Program, School of Nursing, Emory University. This letter is in regard
I have received a communication from the address to the State Nurses Association and the District Nurses Association from the director of the ANA regarding continuing education for staff of professional associations and voluntary and official health agencies. It is a listing of the continuing education courses offered during the 1966 year. I think that we did have also a communication from ANA regarding the nurse, Army Nurse Corps need for nurses. I think that completes the communication, and we'll now have the report of the Secretary, Ms. Alston.
I give you a resume of executive board meeting. Fifth District Georgia State Nurses Association Executive Board meeting, March 7, 1966. The regular meeting of the Board of Directors was held on Monday, March 7, 1966, 4:30 p.m. in St. Joseph Infirmary. Excuse me. The meeting was called to order by the President, Ms. Cole, prayer by Ms. Hudson, and all the three members were present at our meeting that is formed. Our President made an announcement that Mrs. Edna Lewis, whom we have secured the 5th District parliamentarian, could not be present for this Board of Directors meeting or for the regular district meeting on March 10, 1966, but she will be available for all other meetings. Also, she reported that Mrs. Margaret Thurman has been advised and will be available if and when the 5th District GSNA should need her for legal counsel. In old business, the board discussed ways and means of making our regular district meeting more interesting and make it so that we could secure more members, such as streamlining reports in order to shorten our business days.
Thank you, Ms. Alston. We have a trade report, Ms. Mays.
Income from professional nurses, in 1964,
1966. Their total is $36,533.80. Expressed as expenses over income is $25.40. Nurses extras December 1964 was $5,209.31. Last is $25.44. December the 31st, 1965, $5,183.87. I move that this all is passed.
We have this January 1966 report. February 1966 report of the district, as well as the audit report for 1965. Is there discussion, question? All in favor of accepting this report, please indicate by saying aye. Aye. Opposed, no. We'll have the executive secretary report at this time. Ms. Atkins, I'd like to make just one note here. Some of you, I'm sure, did not hear all of the figures. And Ms. Mays, I think she and her committee and the board, we noted that we were dealing, or this committee was dealing with something like $60,000 to $65,000 managing the finances and affairs. So I think the audit reports are in and they're balanced, and I personally would like you to know the work of this group in this particular, but it is a tremendous job and we do appreciate it. Thank you.
I think we ought to thank our treasurer for having the budget balanced and left over some savings. We have about $392 left over after all the bills were paid, and they have been transferred to the regular savings account. I'll make my report very brief, but when she mentions $35,000, I'd like to tell you one thing. We either have to have a system to get $35,000 recorded, because every receipt has to be given for those bills as they come in, and it takes time. It's very tedious. If you had seen the mail Tuesday morning, I had 105. I did not get to post all the books Friday. We went to the Church for Congress, and Friday we had to get out to 500 notices. Monday we had the board meeting. So Tuesday, it took me from 7:30 in the morning until 10 minutes before to post to 105 members. That was $3,013.50 or 75 cents. Out of that group, several did not sign the check. Some sent us checks for more than the number. We had some sent us a State Board of Examiners card. We also had several cards with no card, and many sending me application forms. Those forms that you see floating around here, but with carbon paper, are for members who are being reinstated or applications. Now, we ran out of punch cards last year because we had no more money, and we asked you to please hold on to that card. It's absolutely essential that we have it, or either we'll have to have extra clerical help. Now, when I take that card, I know that you've been to check the State Board of Examiners, stamp it, put what number you are, and I did this morning 136, the ones that we received Tuesday, and the ones we had on file. So, excuse me, in a matter of business, we will either have to keep our system and look to you for your cooperation in telling the others that we have 15,000 names to check, and if they'll just merely sign the card and give us the telephone number for the directory, get the registration. And I might say the deadline for membership dues, 31st of March, and also keep in mind about the directory. Now, right now, today, mailing the list at noon, we have 683 members of 4 associates. Of that group, we have 49 new members, or people who have been reinstated. And I think much of that goes to our new chairman of the membership committee, Ms. Wood. I don't know whether she's here, but if she is, and I'll tell you that lady, where are you? Right under me. Let her tell you herself. Well, anyhow, of the members, we have CESR Section 7, EACT 70, administrators 161 with one associate, general duties 96 with one, occupational health 34, public health 95, and private duty 220 with two associates, making the total 683 with four associates. And while I'm on the fee, this is not part of the report, but if any of you interested in the finest little tape recorder on the market, if you want it for your classroom, safety convention, if you want to see me afterwards, they told us to bring it down for you to see. We're not endorsing it, but we have people who told us it is the finest and very inexpensive.
For today is evidence of our effort in your behalf for this session is a joint responsibility with the program committee on the careers within your May presentation. If you will take your roster for members this year, if you have any ideas that you wish to propose, I would like for you to contact these members within the next few days, because we have a tremendous responsibility for presenting the annual commemoration and council session, May 1966. Thank you.
Do you have anything?
No,
training?
No training.
Bylaws and systems? Finance, Ms. May?
The finance committee met February 24th, 1966. The council meeting was about the tax law. We spent 1 hour and 10 minutes discussing how money could be raised for the delegate to the convention. And the one recommendation that we came up with was that we give this to the sections and let the sections see about helping the delegate. Now, where you people have a voice in that, whether you're interested or not. And for the people that are here and the ones that are here, I've given you sort of a streamline. So last report in January, I told you we put back in the bank out of our savings $1,781.62. But we added $392.28 instead of the $200 that Ms. Atkins just reminded me of. That was $392.28. So the total we have in our savings, that is of the old savings, is $2,211.95 at the present date. Now that is what we have from the old savings after we got ourselves straightened up this past year and started on a running basis. Now this recommendation, the sections with the district raise money for their own gallery.
send them all they need. In other words, I think that'd be nice and we'd like to do it, but what are we trying to do? Are we trying to raise $200 per delegate or 400 or what is it?
I would just like to say that the reason we're in this mess we're in now on finances is because of this district having to spend so many days. And that's why they work. And somebody's gonna have to dig, the delegate's gonna have to dig down their own pocket to take part of their own weight. That's when the rest of the cities up to the
Get back to the motion then, I don't know that it was made clear whether we were gonna assess people 2% or not. If the state pays $100 and so many dollars, it seems to me we need to know exactly what that is, and if we wanna give the delegates $200, then what is the exact figure we need to raise in order to give them $200?
For clarification, at this time, we have 683 members, and to give the delegates the $200, and if I remember correctly from board meeting, there was $2,000 in funds, and there are 17 delegates. So it seems that for safety here, we need to think in terms of approximately $900 to even give fifth district delegates an additional $100, bringing them up to $200. If the chair may suggest or certainly throw out here some thoughts, our particular section, we had in another meeting, and someone, we were just talking about how we could raise money fast. We thought, somebody's suggestion sounded pretty good to me, that we charge more for our dinner meeting than the dinner cost, have the proceeds going. I think we need to give some attention here. Certainly, the board gave some attention, the state board gave some attention. We can't take it back to state. The board will meet one more time prior to, unless we have a fall meeting. And it's March 10th, the convention begins in early June 12th, I believe. So this is what's involved. If we give our delegates approximate cost of $400 each, and have 100 from state, it's $300 per delegate, which is $1,800. So, no, we have $2,700.
I'm agreeing with having the dinner meeting and charging extra for it. That's the only way we're gonna get it. We especially won't get it. If they come and eat, they'll pay.
There are 17 district delegates, 9 of which are from 5th district. fifth district be assessed a certain amount, 50 cents or $1, in order to finance the expense of the delegate. Do you wish to retract the motion or? All right. Are we ready to vote? The motion I just read, attempting to read $2, assess each member $2. All in favor, please indicate by saying aye. Opposed, no. I have to ask you to stand. All in favor, please stand. Opposed, please stand. The motion is lost with 36 noes and 11 yes. I suppose that the section representatives that were at the board meeting will discuss this with their sections, membership, and this, I believe, is beyond, unless the membership wishes to entertain another motion regarding this. Legislation Committee, Ms. Dixfield. Membership, Ms. Wood.
Ms. Wood asked me to give her report, and they did review the credentials of members on the 15th of February and approved 23, declined 1, and they'll have another meeting on the 15th of March next Tuesday, and we already have 24 for approval there. They are going to show the film that we have from AMA and plan an intensive recruitment campaign.